A very good afternoon to you, and thank you for joining us for this talk show. Well, today, social protection is recognized all over the world as a critical element of national development strategies. It is recognized as key to reaching vulnerable, often excluded sections of the population, thereby achieving inclusive, pro-poor, equitable development. Now, the government of Uganda, under the Ministry of Gender, Labour and Social Development, with support from development partners and the Irish Aid, is implementing the Social Assistance Grant for empowerment in all the districts of Uganda as a way of providing income security to the vulnerable people and individuals, in this case, the older persons. Now, joining me in this discussion this afternoon, we do have two people on my panel. But first, thank you so much for joining us. I am Mildred Pedun. First, we have Stephen Kasaija, who is the head of a program for expanding social protection. Good afternoon, sir, and welcome.
Yes, thank you. Good evening, viewers.
Yes, and still with us on my far left, we do have Site Akatkunda, who is a Senior Program Officer, Communications and Advocacy for Expanding Social Protection Program. Good afternoon, and thank you for joining us.
Thank you, Mildred. Good afternoon.
Yes, I would like to start with you, Stephen.
Yes.
Help us to understand what the ESP and the SAGE is all about.
Thank you, moderator. The ESP stands for Expanding Social Protection Program, and that's a government program which addresses issues of risks and vulnerability, which affects a section of the population in Uganda. And the SAGE in particular stands for Social Assistance Grants for Empowerment. It's one of the components of the Expanding Social Protection Program. Under that program, we have been doing several things. One of them was to develop a social protection policy for this country, which addresses all the risks and vulnerabilities which our population face. But alongside, we were able to pilot direct income transfers in terms of cash to our vulnerable populations. We started with two programs under the SAGE. One was the Vulnerable Family Support Grant, but also we had what we call the Senior Citizen Grant. Senior Citizen Grant, we target older people. It started as a pilot, and we are doing people who are 65 years and above, also 60 years and above in Karamoja region. The reason was to learn and see whether direct income transfers could work for our population and address issues of risk and vulnerability and poverty. That experiment worked well, and we have been able, as you have mentioned at the beginning, that the program now covers the entire country. It was because of the lessons we learned from it. The Vulnerable Family Support Grant, after the test, it didn't pass the test because its targeting and selection mechanism was a bit complicated. People could not understand it directly in the community. So we opted for one which is very clear, categorical, age, you are in. The other one was targeting vulnerability in terms of poverty, and it was very hard to differentiate which family is worse off than the other. So we decided to drop that and go with one category. So ideally, the program and all the components are about addressing risks and vulnerability, which affect all of us in actual sense. Only that social protection is broad, and when we talk about it, different categories have different schemes. For instance, older persons, you're giving them a pension sort of old age grant. Persons with disability can also get a grant, a disability grant. Children could get a child grant. For those who are working, you and me, when you retire, you can get your pension. But if you are in the private sector, you get your NSSF, National Social Security Fund. That's also part of social protection.
Okay. Yeah. To you, Site Akatkunda, walk us through the status of this program and the status of the beneficiaries as well.
Thank you very much. Like Mr. Kasaija has mentioned, the program started in 15 districts as a pilot, and the age then, the targeting age was 65 and 60, like he mentioned. But because of the positive impacts that the program generated within the communities that were receiving the grant, there was a need to roll out the program nationally. And so beginning 2019-2020 financial year, the program was rolled out across the country, and right now it's targeting 80 years and above. Older persons that are 80 years and above qualify to be enrolled on the program, but also they are required to have registered with the NERA and possess a national ID to access the grant, because now it is a requirement that actually to even open a bank account through which the grant is credited and delivered, an individual is required to have a NIN. And so our older persons are required to be 80 and have a national ID, and also they are not required to be, they are not supposed to be pensioners. In other words, pensioners are not receiving the social assistance grant for empowerment because they are already benefiting from government on another angle. Yes.
So picking from what you're saying, you have just listed the people that, you know, the beneficiaries, those that qualify. So I would also like you to walk us through what is the criteria that you use to, you know, identify that someone is eligible. I could start with you, Mr. Stephen.
Yes, for one to be eligible, one, we are using, we are targeting using the NERA data. NERA registered everybody to get a national ID. So NERA shares with us that database. So through that, we are supposed to collaborate it in our MIS, and we are able to choose people who are 80 years and above in that case. And once we have got those lists, we are able to share them with local governments, district officials. They go down to the ground and they vet, verify, and see that these people are of the right age. They give us returns. Based on those returns, then we are able to register the beneficiaries, share the information with the bank, because currently we are using Centenary Bank to do the payments. The bank goes down on the ground, enrolls, and registers those people into the system. So ideally, basically, that's how we are going about that process. However, there are people who had joined earlier on before they were 80, and those ones are already on the program. They were already being paid by Post Bank. Now, those ones we have had also to work on them, migrate them to Centenary Bank, though we have issues that some of them didn't have the national ID, and that is being addressed currently to make sure they get national ID and open also bank accounts with Centenary Bank.
Okay. Ms. Sight, in a case that someone turns 80 years when the registration has already, you know, been completed, how then are they going to benefit, or how then are they going to be part of this program?
Yes, the process of verifying beneficiaries is always continuous. So when one misses the verification process, when we go back to the field again, they are able to be captured and verified and registered into the program. So it is actually, we work with the local governments, of course. We work with the Department of Community Development at the district level, together with the parish chiefs and other lower local governments. And so they help us to reach out to those older persons and identify them. And when we go back to the field, we are able to pick them from there and get them enrolled onto the program.
In terms of coverage, how many districts in the country have you so far, has this program so far reached? Mr. Stephen.
Yeah, the program currently,
it's okay.
The program currently covers all the 146 districts in the country, and yes, including the 15 where we started as a pilot. Then you remember that when the program started, we were using 80 and 65 and 60 years. But along the way, when government saw the high demand, We had even introduced people who were oldest 100 per sub-county. Some districts came on board, about 50 of those came on board. Until now, we have gone to 8 and above and cover the entire country. So all the districts are there, and they are all accessed.
Okay, how much money are we talking about when it comes to, giving or offering assistance to these elderly people?
Yeah, for individuals, we are giving 25,000 shillings per month. That money is received. Originally, in our guidelines, we were offering it for every 2 months. We would pay 50,000. But now, given that it is fully now funded by the government, and government releases money quarterly, we have found it to be more cost effective that we pay once in a quarter, so that we save these people costs, but also we save the program costs of going several times to pay. So people can receive 75,000 in a quarter, 3 months, and they go off. Yes.
Someone would argue that 25,000 is quite a very little amount of money, given the times that we are in, and also, the basic needs, the commodity prices and all of that. How do you view this?
Yes, I think I agree with you that the times have changed, but 2-3 years ago, when this grant was being offered at 25,000, it was still meaningful, and it meant a lot. So I would say yes, the value has been affected by the inflation, but I think government is doing everything to try and stabilize the economy, to make sure that the value of our currency remains. So I believe the money will still do something. Of course, 25,000 is about 20% of the average expenditure per poor individual, and we still think it does a lot for these older people. We can only see it through the evidence we get on the ground, that 25,000 looks very small for us who live here in urban city, Kampala and the rest. But when you go down and you see how people can budget for that money and you see the things they have done with it, you find that it can change lives and can transform lives. And we have real life experiences of that. Ideally, that you find that for these older persons, that money, it depends how one has programmed themselves. Some don't get it and buy food and finish. Others are thinking of even investing. So if somebody gets his 25,000 and says, I'm going to pay some labor, somebody opens for me a garden, plant for me some sweet potatoes, beans, after 3 months, the person will have out of 25,000 something like 1 million out of it, because they would have needed maybe money to buy food over 1 million. But the way they invested it makes them get that 1 million over time, while the other 25 is still continuing to come. So I think that's what we have found. It is how people use it and view it. But again, in some of our rural areas, the cost of living is not like here in urban areas. You find that I've seen when seasons are very good, a bunch of matoke where I come from has been going for 2,000, 3,000. So if a person bought that, it can take them for a week. The same with beans, milk, and so life can go on in some of these areas. However, that is not to say that the value is, if government had enough resources, we should be able to raise that, and that is being considered. But the figure was also determined bearing in mind that government would have to roll out this program countrywide. So you'd have to look at affordability. Can the government afford? If you made it 100,000, it would be good, it would have bigger impacts, but can we afford it for all the older persons? So we have to take all those into consideration.
Very true. For Madam Said, for these persons to receive their money, are they supposed to have like a bank account of sort? How do they receive their payments or their benefits?
The grant is delivered through a payment service provider, and in this case we are working with Centenary Bank. Centenary Bank opens bank accounts for each beneficiary, and so when government releases the money, the grant, and upon verification of the data and and individual's needs, then the bank goes ahead to credit that money on each individual beneficiary's account. And so by the time we are going to the field with the bank, the money is already on every individual's account, and so the bank is just going to cash it out. So we do mobilization with districts and lower local governments, like I earlier mentioned, so that when we are going to the field, these beneficiaries already know, they have the program, they know where we are going to be on such and such a date and time, and so they come to a pay point and receive their grant.
They are given cash.
They are given cash at the pay point.
Okay.
Yes.
So how long does someone benefit from this grant?
This program is a lifetime program, I should say. The moment a person enters the program or becomes a beneficiary of the SAGE program, they will receive that grant until they die. They will continue to receive the grant. Yes.
And when they are, registering, or when they are signing up for this grant, are they allowed to also include some of their beneficiaries in case of like a death, you say?
Yes, the program offers them an opportunity to register an alternative beneficiaries. Given their advanced age, sometimes they may fail to come to a pay point, or sometimes we go to the field and they are sick, and so they are not able to come. But they are given a chance to register an alternative beneficiary who can then receive their grant on their behalf when we go to the field. Once the alternative beneficiary is registered, the primary beneficiary doesn't have to come to a pay point. That alternative is allowed to pick the grant on their behalf. And maybe I should mention that once the person dies, then they cease to benefit from the grant. We have a system of registering death or death notification. So once the program is notified that a beneficiary has passed on, then they cease to receive from the grant. But should they have money on the account at that point when they died, then the family sits and chooses someone who can receive that money on their behalf, on the behalf of the deceased. And once that money is received, then the account is closed.
Because I was going to, I wanted to know if the person passes on, just clarity.
Yes.
They do not receive the grant is blocked or stopped there and then. So what happens in a point where this person probably was having a family that they were taking care of?
Yes, that money is given to them upon the death. Once the program is notified that so and so died, but then the account has money, the money is given to their family to cater for their expenses.
Only when the account has money.
Only when the account has money, yes.
So if it doesn't have, they have to
exit.
Yes, they have to exit.
Well, you said the beneficiaries are supposed to be 80 years and above.
Yes.
Well, someone could argue 80 is way, too high.
Yes.
Given, I want to compare to our life expectancy as Uganda. It stands at 64.
Yes.
Yes. Are there any considerations for you to cut down that, age for someone to benefit from the grant?
Yes, the times we've been to the field and in different engagements with local governments and other organizations, there is demand really that the age needs to be reduced. First of all, because even at 80, these older persons are not able to engage so much in economic activities, so it's like the money they receive is not probably going to be put into good use. But engagements are going on with governments through different organizations, and parliamentary committees have also taken it up. And they are advocating for reduction of the eligibility age to at least 75 or 70. But also we need to be aware that that can only be achieved if the economic situation improves. These matters have continually been brought forward to the responsible authorities, and maybe at the appropriate time we'll achieve and have the age reduced.
Okay.
Yes.
So I believe you do monitoring and evaluation, or you do supervise these grants. Of what impact, in your view, has this program had on those that are already, under the grant, or those that are already benefiting from it? Mr. Steven.
Yes, thank you. The grant has had good results in terms of impacting the livelihoods of these vulnerable households. For instance, we already know through our surveys which have been done that older persons who receive this money are reporting increased number of meals they take. Those who used to take 1 meal a day, they can now report taking 3.
Because they are able.
They are able now to achieve that. Many of these people live with grandchildren. Some of these grandchildren had long dropped out of school for simple things like, because in Uganda we offer free primary education, but you find a child could fail to go to school because they lacked a uniform, because they lacked a few scholastic materials like books, pens. But now this older person, when they have this 25,000 coming in, they are able now to provide a uniform, provide a pen and a book, and the child is back to school, not dropping out. We also know that hunger can be a driver of school dropout. So now these children are assured, even if you wanted them to pack something, there is some food at home which they can carry to school and stay in school. So we have seen those type of impacts. But we have also seen impacts in terms of the local economies where these people live. When this cash comes into the local economy, these people have got that money, the money keeps multiplying within the economy. Yeah, the one who gets it tomorrow is buying paraffin, is buying soap, is buying sugar. In the process,
basic needs.
The money is circulating around. They are employing people to open up their gardens, to improve on their shelters, and so that's money creating employment in those areas. And studies which have been done under this program to assess the impacts and the investment case for social protection, for instance, have indicated that districts which were receiving this grant were able to increase employment upon by 6 percentage points compared to other equal level districts where the program didn't happen. Employment opportunities here, the rate of growth of employment was a bit higher in these areas. So the same with the growth in the economy, it moves much faster in where the money is being spent and opportunities are being created. So we have seen all those. Health-seeking behaviors have changed. Some of these older persons just fall sick and they are not able to go to hospital for simple reasons like I don't have transport, I can't move. But now when you have this money, you can hire a motorcycle and it takes you to a health center where we know services are supposed to be free. You are at least tested and they can tell you, oh, you are either suffering from malaria, and so the next step, if the medicine is there, they give it to you, and if it is not there, you can also be advised to go and buy a dose. So
and you're able to afford.
So we have really seen a lot of transformation effects on these people. And above all, there is a lot of empowerment. Some of these older people have told us, in the past, we have had clear examples. We visited some older person and they told us that the path to their house was never existed. They were there in the middle of sort of a bush. The road which would lead there had overgrown. No one was coming. But when they started receiving a grant, people now start checking on them because people would fear to come, knowing that maybe when you come, you find this older person is sick, they will say, give me I'm very bad off, give me some money. But now they know, there is nothing you're going to demand from this person, people can freely. So the paths have now opened. You can see that a person lives here. That's one example we have seen. We have seen others who used to be lonely, living alone. Now their grandchildren, their sons and daughters who live in urban areas, who had abandoned because they couldn't take their children, even sleep there. We are told, some of them tell you, now I have improved my shelter. It never used to have a door, now I have a door, I have a window. My children can bring their grandchildren, even leave them with me. They can even stay around and sleep with me. So I have company now. That's people never used to come and sleep, but now they can come and sleep. And that's empowerment. We have seen others saying now even I can go to church. I never had clean clothes which would help me to go to prayers on Sunday. But now that I have this money, I have been able to make myself clean. I buy soap, I wash my clothes, I bought a new cloth. Now I can also participate. Even in the wedding meetings, people can invite me now to go for participate in the weddings because I can dress decently, and even when they say contribution, I can also make a contribution. It's empowerment. There is that empowerment which they feel.
And also self-dependence.
Self-esteem.
And self-esteem.
Yes.
For you not to appear like you're a burden in society.
Yeah.
Well, amidst all the good things you've talked about, I believe there's some challenges that you have encountered when we talk about the implementation bit of it.
Yes.
Please do walk us through some of the challenges that you have faced.
Yes, the challenges are there for such a big program. One of the challenges is that some of these older persons, now we have told you, have had challenges of age, registering the right age. Since we are using the national identity card, you find somebody who is 100 years is missing on this program because the national ID may be captured the wrong age. Says the person is 70. The reason being that some of these people are not able to read and write. So when they went to register and ask them, when were you born? They can't tell. So the person looks and maybe say, okay, the person may even state, I'm now 70 years, and that's what is recorded. But now it is surprising when you reach and the payments are happening, then they start noticing that people who are younger than them are the ones getting what? Money. When somebody is 85 years old, me I'm 100, I'm missing. So that's when the cases start coming. So we are having such a cases which we have. But also some older persons who missed registration. They didn't think it was important when the national ID was being issued at that time. So they missed that opportunity. Of course, by then, maybe the program was not in their areas, so they didn't expect that. But now we realize that the national ID has become a very important document. For you to do anything in the country, it is required. To open a bank account, you require it. Now, to join the program, you require it. So some people are also missing because of that. That's one of the challenges. And the other one is automatically the biggest challenge we have is a program for older persons. So people have been challenging, as I say, government people retire at 60 and you start getting a pension. Now for us, older persons whom we are giving the senior citizen grant, you want us to be 80. So we being fair, you being equitable, so we have accepted that that's a challenge, but government is considering that when the resources become available, I think we shall, in a phased manner, lower the age and make sure those people are also covered. And also the other issue of the grant size has been, people are clamoring that we should increase the size of the grant, and that government is also considering that.
Have you encountered a situation whereby some of these people reject this grant for whatever reason they give?
Yes. The program is free to begin with. There is no cost to it. Nobody is supposed to pay any money to be enrolled, and therefore people have a right to be enrolled or not to. There are people who have actually refused to join the program. They have their personal reasons maybe, but they are there. They have not shown any interest to join the program. And nobody is supposed to coerce them because it's a free program. It's delivered by government, and so when one chooses not to be enrolled, then it's their right not to. Yes. So
the registration, does it happen at district level, sub-county or parish level? Just some clarity on that, Ms. Site.
Yes, initially before COVID, we used to deliver payments and also do the registration at sub-county level. But when COVID came, and with all the SOPs that were involved, the program had to redesign the delivery mechanisms, and so now we go up to parish level, up to village level to access these people, because we are trying to limit the numbers at the pay point. We are also trying to reduce the distance that they have to walk. So we go down to that level where the beneficiary lives.
I want to a scenario of if I registered at parish X, and for some reason I have moved to parish Y. Am I still able to access my grant if I'm on the other side of the parish, yet I registered from this side of the parish?
Yes, our system is that once one is a beneficiary, you can access the grant anywhere you are in the country, even if you migrate to a different district, because we've had instances where older persons are taken away from their homes in the villages. Maybe they come to seek health care services, maybe they come to be taken care of by their children or relatives, and in the process the teams are in the field delivering the grant. Yes, these beneficiaries are able to access the grant wherever they are. Even if they had registered in their mother district, they are able to access the grant anywhere they are. Because the system is the same. We have a very good MIS system that can tell or that can capture you even when you are not in your home location.
Okay, yes. So it is possible for someone to access.
It's possible.
Okay.
Yes.
So, Mr. Stephen, I would like you to take us through some of the governing principles of SAGE. Yes.
Okay. Yeah, I would say one is that once you are registered and enrolled, you are entitled to receiving your grant without any questioning. And once you are eligible, you are made the age of 8, it is your right to be registered. We don't have to consider that you are of that age or you are of this tribe or you are of this religion. Those ones are out. You qualify so long as you qualify. We don't consider which political party you belong. You are entitled to be on the program. So basically that is it. And Site could add.
Yes,
maybe to say the ministry is the overseer or the coordinating ministry, and under that's where we have the expanding social protection program. Below that we work with the district local governments, and so we work through the whole government structure the way it is. We don't deliver this grant single-handedly as a ministry or as a program. And so that partnership, that coordination and collaboration has enabled us to actually continue delivering this grant seamlessly across the country. Yes.
So among the governing principles, probably, should someone be vaccinated for COVID-19 before they can join or register for SAGE? Is that one of the ultimatums or one of the requirements?
Well, it's not a requirement that a beneficiary should be vaccinated for COVID. But like I earlier mentioned about coordination and partnering with other ministries and other agencies, during COVID, we had to continue delivering the grant because it was actually much needed then because of the conditions. And so we were collaborating with Ministry of Health, for example, to also use that same opportunity to be at a pay point to assist these older persons access vaccination. And so that partnership actually enabled us to offer those services. We've had other partnerships with other agencies like site savers. They've offered services to older persons to check their eyes and give them some assistance. And so because of that collaboration, one may really mistake it that it's mandatory that someone should be vaccinated, but it's not. Instead, we collaborate with those other ministries and agencies to offer that extra support, to offer that extra assistance to these older persons. Yes, but it's not a requirement that one should be vaccinated. Yes.
Okay, so by number, do you know how many districts that are under this program?
Yes, across the country. We are in all the 146 And yes, because of the rollout, like we earlier mentioned, all 80-year-olds, all older persons that are 80 years across the country and that are registered with National Identification Registration Authority, they are all eligible to enter the program.
Okay.
Yes.
So do you see this program striving, let's say 5 years from now?
Yes, a lot is happening, a lot is hoped for. To begin with, we are hoping that government will look into reducing the age to 75 years or even 70, and so that will give us expansion. We'll be able to cover a larger number of older persons, and I see it as growth. It's growth coming. And if the grant value is also increased, then we are lucky and we are able to contribute a lot more to our older persons, because there are these spillover benefits. We may look at it as beneficiaries receiving the grant, but this grant spills over. It's the communities, it's the households, even us who are mandated to take care of our parents and grandparents. We are also helped in a way. If we were to give them 100,000, now that they receive the grant, then we can give them maybe 50 or 70 as a top-up, and then we can use the rest for our own developmental purposes. So there's growth coming that we've seen, looking at the way the program has evolved from the pilot to a phased rollout, and now to a national rollout. And now we are talking of expanding by reducing the age and increasing the grant value. There's a lot of potential in this program.
Okay.
Yes.
So, Mr. Stephen, let us talk about the management of this program. Yes. How is it managed?
Yes, the program is managed under the Ministry of Gender, Labour and Social Development, where we have a program management unit, where myself and SAGE sit. Under that program management unit, we also have at the regional level 10 regional offices. We call them regional technical support units in 10 regions. Each regional technical support unit supports about 15 districts. At the district level, we have a senior community development officer who has been assigned by the district chief administrative officer to be in charge of this program. That senior community development officer also works with the officers at the sub-county. We have a sub-county community development officer with the sub-county chief, but also they go and support the parish level, where we have a parish chief. We also have the councils, the LOCs, we have the older persons councils. All those are structures which help us in the governance of this program. Each one of us has a role to play. You can find that at the lowest level, the LOC one, the councillors for older persons, and the parish chief are running the show in terms of verifying, identifying these older persons, organizing them to go for payments. They do all that, filling in forms which are required at registration, death notification, which I talked about. If a person has passed on, these are the people who are doing the change management, filling in those forms and passing on through the system until they reach the RTSU and the change is made in the system. So at our center, we are in charge of the policy and also issuing the guidelines, also doing the budgets, making sure we have got the money from Ministry of Finance, it's processed and it's paid into the beneficiary accounts. We have to supervise the bank which does the payments, ensure that we are sharing the payrolls and we are getting the reports from them who has received money on the account, who has not received, to make sure that we are also monitoring the whole processes of payments, which process is not going well. And so we do all that as a program. So we also have a steering committee, a national steering committee, which is chaired by the Permanent Secretary, Ministry of Gender, Labour and Social Development, and it is composed of several government, it's a multi-sectoral effort. We have Office of the Prime Minister on that committee. Minister of Finance sits there. Minister of Local Government is also there. We have the civil society, who are also part of that. Minister of Public Service, they are all there. And so that gives the policy guidance to the program.
Thank you so much. SAGE, as we wrap this up, I would like you to give your closing remarks and maybe any other additional information that you would like people out there to understand or to get to know about SAGE and ESP.
Thank you very much. My parting shot would be to encourage our older persons or their caretakers to ensure that even those that have not registered for a national ID, to go ahead and do so. We've had to do some outreaches with the NIRA, and I'm grateful to NIRA that they came out to support us and target our older persons and go down to the grassroots and register them. But we still have those that remained behind. So it requires that we keep going back to reach out to them. But then NIRA, as you know, has branches on at district level. So it would be my appeal to the older persons and their caretakers or children to enable them reach these NIRA offices and get registered so that they don't miss out on the program. As we go ahead to also look for ways of helping those who have wrong details on their ID to be able to get them corrected and then capture them into the program.
Thank you so much. Your parting shot, sir, as we wrap this up.
Yes, I think I wish to thank you for hosting us on this, because it has given us a chance to educate our communities, our public, about how the program operates. So I wish to appeal to all of us to support our older persons. Those who are getting, yes, we should encourage them and support them to get the money, protect them to use it well. For those who are not yet getting, I would wish to appeal to all of us, the young people who are working, if we have relatives who are older persons and are waiting to reach the rightful age to benefit from this program, that let us continue supporting them, because it is our responsibility also as individuals to support and provide social protection to our older people.
Thank you, Stephen Kasaija, Head of Program for Expanding Social Protection Program. Also, Site Akatkunda, the Senior Program Officer, Communication and Advocacy for Expanding Social Protection Program. Thank you so much for joining us this afternoon. I've been your host, Mildred Pedun, and we say have a good evening, and more programs are coming your way.